Global Health Beat, where we explore the trends, nuances, and opportunities for HCP engagement in international markets. I'm Amanda Preto, and I'm very excited to be here with my colleague, Matt Durham, Director of Global Marketing, with Dr. Richard Bamberry, co founder of OncoAssist and a medical oncologist in Ireland, and Kevin Bamberry, co founder and commercial lead of OncoAssist. Today, we're exploring Ireland. We're going to talk about what health brands need to know for successful HCP engagement with prescribers in this region. Let's get started. Hi, Richard. We're going to start with you today. Thanks so much for being here.
Thanks for having me.
I would love to hear from your perspective as a prescriber in Ireland, how you feel that pharma and healthcare brands are delivering on the information and the tools that you feel you need to be educated and to treat patients. Where are you seeing strengths or gaps?
Sure. We're lucky in Ireland in oncology. We have a very productive interaction with our pharmaceutical colleagues. There's a number of facets where we work together to improve care for patients. One of the most productive is, they help us with early access programs or compassionate access programs for new medications. And those medicines might not yet be available through the EMA reimbursement system for prescribing, but they've been shown to have benefit in early phase clinical trials, and these programs allow us to access these medicines for patients before they're widely available. Some of the other ways we have very productive interactions is through educational grants, where we can apply for pharmaceutical company support so that we can access educational materials, so that we can attend educational conferences such as ASCO or the ESMO, the European Society of Medical Oncology. There are some of the early ways we can interact.
So, Richard, you had mentioned to me when we spoke before about nursing at home and some other aspects of early care. Could you talk to us a little bit about that?
Sure. So again, the pharmaceutical companies often with new medications provide a nurse at home service where patients, rather than coming to the hospital for checkups, can have nursing do blood checks and nursing assessments at home. It decreases the number of hospital visits for those patients and allows them to safely take these medicines at home, and they're often supported by the pharmaceutical companies. And the other major way we can have a positive interaction is when a new medicine becomes available, where they help us by providing things like therapy management and dosing management content. Sometimes those are in hard copies, and sometimes those are in a digital format, so that we can, safely manage toxicities of new medications and things like that. One way that maybe there could be an improvement in that side of things is, rather than providing specific drug-related information, if we could get information on how to manage a class of drugs, sometimes that can be more useful clinically. So, for example, if it would be much more useful to have an immunotherapy toxicity management algorithm than it is often to have a management algorithm for one particular drug. So that's one area that I think we could work together to improve.
Wonderful. What an important advantage for patients and for caregivers in Ireland. Thank you for that. Matt, I would love to pivot to you from the planning perspective. So, where are you seeing uniqueness, nuances in terms of media planning in Ireland?
Interesting question. Like when we think of Ireland, when we look at Ireland, there's two things that come to mind. It probably sounds like it contradicts each other, but I don't think it does. But when we look at the data that we have on how we plan for HCPs in Ireland, the one thing we see is always when we're asking like what are the most important most important source of information, regardless of the specialty, nearly always within the top two, they're saying like their peers, like their colleagues, like they really value interacting with their colleagues, whether that's at congresses or just in the same hospital. And Ireland is a little different, I think, than some of the other countries we've spoken about, this year, where it's a much smaller country, right? It's like 5 million people, meaning there's also, a lot less doctors. And I think maybe because there's more of a community around some specialties, right? They work a lot closer, so they work so closely together. So we see them interacting a lot like that, and we try to think about how we can kind of engage with them from that perspective and take advantage that the key source is their peers. But something that contradicts that slightly, knowing that like there's such a tight community a lot of the time, is that when we look at where we can find them online, especially online, we know in Ireland there's lots of great platforms, right? There's Irish Medical Times and Irish Health Pro and GP Buddy, these type of platforms. But increasingly we see them engaging online on international platforms, especially like the HCP social platforms like Soma, etc., GMed. So maybe more than a lot of the other markets we've been speaking about in other sessions is how internationally minded a lot of the oncologists or HCPs in Ireland are. So there's always so many opportunities, like ways to reach them when we kind of think about reaching HCPs beyond their borders in Ireland. I'm interested, Dr. Richards, that's the same from your perspective, that there's lots of great local media or local opportunities or platforms that you engage with, but also international ones are also important to you.
Yeah, I think a lot of the oncology community in Ireland is very kind of outward and international looking. Most of the consultant or attending medical oncologists in Ireland have been trained in either usually North America or sometimes in the UK. So a lot of them have done fellowships in places like Princess Margaret or Memorial Sloan Kettering, Johns Hopkins, MD Anderson, or in the UK places like Royal Marsden or the Christie. So they would have a lot of international networks in that regard, and then they would also attend regularly conferences like ASCO and ESMO. In terms of digital platforms that would be very popular, one that sticks out to me certainly is MedNet, which is a kind of a global platform where healthcare providers can discuss interesting or tricky cases and get information on how others internationally would manage them.
Great. Let's move over to Kevin and talk about your platform, OncoAssist, which is a global tool. So, Kevin, how are you seeing a difference in how prescribers in Ireland are engaging with OncoAssist compared to prescribers in other countries?
Yeah, so OncoAssist, we've been very lucky in Ireland. Irish Pharma were our first partner. We're the first group we started engaging with. We tend to find them very innovative. They try to work with us in kind of new and innovative projects. We'll often pilot new concepts in Ireland. So if we have an idea, maybe we jointly, as a result of a meeting, come up with an idea that we can pilot together on the Irish market, and then we'll bring it to global or regional teams, and bring them all the information and the feedback we've got from the Irish market and scale it to other markets. So, we find that the Irish oncology community and pharma community is very agile. They're very open-minded, work closely with us. We've been very, very lucky since OncoAssist was founded to work closely with them in growing OncoAssist and growing our engagement with pharma companies.
That's fantastic. What is one thing about healthcare marketing or prescriber engagement in Ireland that you think might surprise others in other countries?
What might surprise people about healthcare in Ireland in general, I think, is that there's been huge advances in the health system and in health in general in Ireland over the last 20 years or so. Ireland has one of the highest life expectancies of all OECD countries, based on data published in 2023, and despite that, cancer remains the biggest cause or the leading cause of death in Ireland. And a study published in the Lancet Oncology showed that because of probably organisation of cancer services in Ireland through organisations like the National Cancer Control Programme, there's been huge advances in cancer care in Ireland over the last 20 years, especially with things like centralisation of surgery for more complex malignancies like esophageal cancer, development of robust multidisciplinary teams or tumour board conferences, as they're called in North America. And I suppose the other thing I think that would be useful for pharma to know is that there's a very highly trained oncology workforce in Ireland, with most of the oncologists having trained in North America or the UK, and they're very much keen to innovate, collaborate, and certainly bring clinical trials to Ireland of novel medications. And we do have a very robust clinical trial network through Cancer Trials Ireland.
That's fantastic. Thank you. And I was hearing the exact same thing, that prescribers in Ireland are collaborative and open-minded, and as Matt noted, internationally focused. Thank you all so much for this insightful conversation so that pharma brands and healthcare brands know more about prescribers in Ireland. This was great. Don't forget to join us next time on the Global Health Beat, and remember to like and subscribe.